Biggest issues related to EMS is just the number of calls that folks are required to respond to on an annual basis. We get somewhere between 120 and 130,000 calls a year. And when you look at the calls and you analyze the calls, they are over 60% of them are non-emergency. And as we both use the word emergency,
Sure.
that is really the issue that we ought to be addressing and that we need to, of course, focus on and make sure that we serve people who are really in an emergency situation. You rectify it in a number of different ways. There are things that we need to do internally that we need to do better, and we're going to do better. The fact is we've got unfilled vacancies for EMS technicians, and we just started an academy on February 7 to hire more. But what we've realized is that because of the kind of attrition rate that we get for EMS techs, we need to run academy after academy after academy and have people ready to enter the academies. There's a process that we have to go through in human resources to identify the people, test the people, and have them ready to go in. And so what will happen now is we've already scheduled our next academy for early June to start immediately upon the finish of the current academy. And we really have to keep this almost like an assembly line process. So we are continuing to get people coming through the academy so that we're constantly keeping vacancies filled. We need to take steps to freshen our fleet. And when I say freshen, what I mean by that is these vehicles average 30 to 40,000 miles a year. And so we've got to work better with our apparatus department to turn them out more quickly. We need to work more efficiently with the contractors that we have who are at the two dealerships. But we also have to buy some new trucks. We had been on a schedule, I understand, where about 16 new trucks were bought on an annual basis. For a couple years, we had not purchased new trucks. We are now in discussions with our chief financial officer to make sure that we include and find the necessary funds to purchase new trucks. One of the things we also need to do that is very important is we need to have better collaboration internally about how to respond to calls. What I mean by that is that as we take a look at the call and whether or not they're emergency and whether or not how we respond to it, we have to look at other alternatives other than just sending an EMS truck. The fact of the matter is that we are contemplating a no-send policy. But that would only come after we are in a position to respond fully to the emergency calls, after we've gone through an education with our community to talk about what are the kinds of calls that we will respond to and we won't respond to, right, but also how we then look to give people information about where they can get the services they need. And so we're working with our health department to analyze what kind of calls we've been receiving and therefore what kind of needs we're going to have in terms of trying to bring the greater medical community into our situation. We have to make sure that our folks are well trained. We have to make sure that we're obtaining all of the necessary information in order to make the decision, and we have to make sure that essentially we're assessing correctly. Right. But when you are dealing with 120,000 calls a year, you're in much the same kind of difficult situation as you are trying to allocate rigs and respond to these thousands and thousands of calls. And so we believe that, in fact, by making these kind of decisions in an informed way, we are going to be able to respond to the true emergencies in a more effective way.